Good morning and good afternoon once again. Welcome to today's webinar with ZeOmega and Comm100, transforming consumer engagement with live chat and IA. So let's go through 5 reasons why live chat is ideally suited to population healthcare management, and some of these we've already touched on. The first one, and perhaps the most important one to give confidence to your consumers, is the notion of security. And I mentioned that earlier on. Communication on the Comm100 platform is heavily encrypted, totally HIPAA compliant, and completely private. So if you're engaging in a chat with one of your consumers, that data can't be intercepted, can't be decoded, can't be stolen, and is backed by HIPAA compliant agreements to make sure that personal health information is protected and defended according to the highest standards of law in North America and elsewhere. So security is vital. By the way, this extends also to the practitioners and agents. You can lock down the Comm100 platform so that the agent console, the inside, is only accessible from a certain IP range. So if you have remote workers that are working from home or a remote office, then you control access to that IP only, or to your own office. And then nobody can get in and fake being an agent. Nobody can hack into your system and steal conversations from you because you've blocked those IPs, as one example. And there's all the password rules and all the authentication protocols and single sign-on that a population health management provider would want to offer to make sure that the conversations are secure. Next is flexibility. And I mentioned a little bit about the ability to configure live chat to perform different ways, whether it's in your mobile app or your website, whether it's a tier 1 customer or a tier 2 customer, an immense amount of flexibility in how you want to use the live chat platform to connect with your consumers. I mentioned responsive versus proactive chat, the ability for you to initiate a conversation with one of your consumers, and doing that in a context-sensitive way. So that flexibility is really what enables you to go to the next level in terms of personalized and genuine communication by making it most relevant to where the consumer is on your website or in your app, so that you're having the most relevant conversations possible. Accessibility is obviously a tremendously important element in the healthcare space. I already mentioned you can install Comm100 on your website, in your mobile app. I mentioned it's multi-language, so that tears down barriers. Comm100 is also WCAG 2.0 compliant, so we meet all accessibility standards as determined by the ADA and the WCAG group to make sure that people with communication disabilities or limitations are able to use our platform in complete confidence and security as well. So that's important for certain slices of the population as well. Accessibility is a must. Last but not least, or next but not least, is the notion of always on. Communication with your consumers is a mission critical protocol. You can't risk the phone lines going down. You can't risk your live chat going down. Comm100 offers you the ability of guaranteed uptime by building in technology that makes sure your core systems cannot fail. I'm not going to go into details here, but suffice it to say we have failover protocols and backup systems that will turn on in the event a frontline server goes down for whatever reason, because we know you as a healthcare provider want to make sure that those platforms never go offline. So 24/7 availability if you need it, and guaranteed uptime because you need it. Last but not least, and this is an overarching theme, is the personalized nature of communication via live chat. It is a one-to-one tool. It is practitioner, provider, directly to a consumer. And the ability to do that via text or audio or video and share images makes that connection incredibly personal, incredibly genuine. And let's face it, intimacy is a big part of healthcare, and you want to protect and defend and give people confidence that you are able to connect with them in the way they need, understand what's going on, and deliver the services you need. Matt, do you want to add anything here else around the importance of personalization in live chat?
Yeah, I think too, and as I think about especially vulnerable populations, people who really need help with traversing the healthcare world and who might need a lot of services, it is very difficult without that personal connection to share some of the issues you might be having. I think too, for behavioral health or depression issues, seeing someone face to face, being able to start a diagnosis by not just the words they're saying, but how they're saying them and how they look while they're saying them, can really take things to the next level. I know that is one of the reasons why home health is exploding, because that you're able to get that connection. But of course, you can't afford that for everyone out there. So this allows you to extend this in a way. And if you think about too, like a Medicare Advantage plan, people who are 65 and older, you need that outreach. Yet these are people who are used to visual chatting, with their family members using their phone or their iPad. They're used to doing monitoring in their homes now. So they're going to accept this type of communication. It's going to be just a part of all of the things that they do. And offering this in a way in connection with a care manager, again, their job is to do this outreach. So creating that additional channel is a big plus.
Excellent. All right. I just want to point out to people, Matt and I have been sharing a lot of insights and a lot of nuances related to the population health management sector. In your GoToWebinar control panel, there is an area there where you can submit questions. It's called Questions. So please go ahead and drop your questions in there. We have reserved time for at the end of this session to address any questions you might have, whether it's about live chat in general or specifically to Comm100 and ZeOmega. Use that questions window to pose your question, and we will get to it in just a few minutes. We have one or two more sections to go over. All right. Thank you, Matt, for that extra context. One thing that you tipped me off and thinking about in personalization is you're on a video chat with a member, and you can read body language. You can see their physical symptoms if they manifest, but you could also probably get a sense of their living conditions through the video. In the background, you can ask them to show you their sleeping area or the safety of their washroom, for example. And that is not a scalable thing to do in person, but it's immensely scalable to do via live chat. So hopefully that covers what we need to cover for today. I want to thank the audience for their patience and their attendance and their great questions. Matt, I want to thank you for your insight and context as always, and encourage the audience to reach out to either Matt or myself when you need to take it to the next level, answer any questions you may have.